Okay. Okay, good afternoon, everyone. Thanks for tuning in. I know this, we called this town hall on short notice, and it's not our normal broadcast time. However, COVID has required us to make some adjustments, and we want to be clear about what's been adjusted and make sure you also understand how we've made these decisions. As most of you know, yesterday, Governor Inslee announced some changes to the state COVID restriction based on the increased COVID cases, and I think everybody's aware of that. This includes a travel advisory recommendation that came out last Thursday evening, limits on social gathering, limiting public building capacity to 25%, closing gyms and bars, and limiting restaurants to takeout or outdoor seating only. He has designated these as temporary measures through the 14th of December. As we've said from the beginning of this pandemic, we will try to be in line with the restrictions and advisories Governor Inslee puts out. It's served us very well thus far. That's part of being a good neighbor, and given that 70% of our service members and their families live in the local community, it also makes sense. As our Washington state leaders also understand, we have ongoing missions here at JBLM which require us to maintain our readiness for the nation. Continuing to train our service members and maintain our equipment means we cannot always be in line with every specific restriction. Where we've had to adjust differently, and that's very few areas, and I'll cover those here in just a few minutes, we have definitely stayed in line with the intent of Governor Inslee's restrictions. This afternoon, I'm going to explain the JBLM restrictions that we will put in place for the next 4 weeks. In making these decisions, we weighed 3 important factors: safety, readiness, and mental well-being. We understand our decisions have an impact in each of these areas, so we tried to find a proper balance. We then looked at what we do know about our JBLM population. I'm going to cover that for you. 1, we know that our community has lower COVID numbers than all of our surrounding communities. While we too have seen an increase, our increase is much lower. And I know there's been discussions, our curves, again, are very similar as far as up and down that we've seen with COVID. We've just had fewer here at JBLM. We know that COVID transmission and training has been very low. We've had deployments to the Pacific, JRTC, and local training areas with few cases. 3, we know that our population is different. We have thousands of young soldiers and airmen who are living far from their homes and families. When we put COVID restrictions in place, they are often the ones that feel it the most. They have a barracks or dorm to go back to and chow hall to eat at. And unlike those of us who have a house or an apartment or perhaps go home to our own families or our pets, our single service members in the barracks often have very few places to go. That's not healthy for anyone. We think carefully about this to properly balance restrictions. 4, we know that most of us are far from our extended family, and being able to see them during a holiday block leave is sometimes the only time we can see them over the course of a year. In some cases, depending on deployment cycles, it could be even longer than a year before some of us again have an opportunity to visit our extended family. So with that background of priorities, we must balance, and the unique population we are as service members and military families, we're going to share 10 restrictions that we will put in place as of midnight tonight, which is when Governor Inslee's decree takes effect. These restrictions will stay in place for the next 4 weeks or till 14 December. And I'll remind everyone now, and I'll do it again at the end, our next town hall is on the 8th of December, so that's our normal town hall that we had scheduled on Tuesday, the 8th of December, and we will give an update to everybody then. I'll also remind everybody that you can find exactly what I'm getting ready to put out on the blue hash document that's going to be on the main page of the JBLM official website. Just look in the lower left-hand corner, and it will have an updated as-of date on it. And we just went through it and simplified it. It's one page, and you'll see that posted there as well. Okay, let me go through the 10 updated restrictions. The first one is not an update. Number 1, as they have been, Masks in all public buildings and physical distancing are required. 2, commissary PXs, the PXs and shopettes are essential. They will be reduced instead of the 25% to 50% capacity. All other public facilities, libraries, community centers, barbershops will be at 25% capacity. Our on-post public eateries will be takeout only. So this includes the food courts, the Texas Roadhouse, Burger King, Starbucks, Qdoba, Jimmy John's. I'm sure I missed some of them, but all of them out there, any other eateries will be takeout only. Our Warrior restaurants and dining facilities will go to 25% capacity for eating in. So that is an adjustment, but again, if you're a single service member and the only place to go here is a dining facility, and we're looking at working to extend the hours, and those will go to 25% capacity. We are also, number 5, going to keep our Warrior Zone open at 25% capacity. And I know our MWR team has done a great job with that. It's a very large building. That will be at 25% capacity, and we have the mitigation measures in place. And again, that's with the service members that are in the barracks in mind. 6, gyms, we are going to keep open for active duty only, so active duty, activated guard, and reserve only in the gyms, because it's a readiness, for us it's a readiness issue, rehab, PT, all of those things, so those gyms will stay open for our servicemen and women. And then pools will remain open, but also again for active duty, and that is for fitness and military training. 7 is faith-based services will be at 25% of the building capacity, and I know that our PM docs and our chaplains have been working that, and 25% capacity. 8, and I don't think we've opened the movie theater, but the bowling alley is closed. Again, go to the blue hash. There's other MWR outdoor rec, for example, is still going to be, there's things that are happening out there, and at 25% capacity, you can still do things through MWR, which we want to encourage getting out. That will remain open. Again, you can look at that on the blue hash. Number 9, no indoor social gatherings, and everyone will see this in the updated general order, and I'm ready to take questions on this. If you're in your house, only the people who live in that house with you should be inside. You can gather outdoors with no more than 5 other people outside your family. I'm going to answer another quick question. I may get another one and we've covered this again in the general order. If somebody had a boyfriend or a girlfriend out there, we were considering that is part of your family. All right, somebody that's out there is part of your family. And so we've allowed for that. I want to hit on social gatherings again. As Governor Inslee has pointed out, this is where the data shows that most of our COVID transmissions are happening, and each of us absolutely has control over this by our daily actions. Even when somebody is often identified in the workplace as having COVID, it's most often traced back to a social situation. So this is where we need everybody's discipline. 10, and the last one that I'll cover. We are not limiting anyone's ability to take leave for the holidays. As we noted, our population is different. Most of us do have to travel to visit our family, and oftentimes we only have a small window of opportunity, like holiday block leave, to see them. Taking that away would mean many of our single soldiers and airmen may sit alone over the holiday, and many of our families miss their one opportunity a year to visit extended families. And we all know that wouldn't be good for our mental well-being. But I also will remind everybody that we have to be smart about it when we travel. And we've talked to commanders, and so the same counseling will be in effect both before and after. and we expect you to abide by the same discipline and standards that we have put out here as far as mask wear and physical distancing, indoor gatherings versus outdoors, and you do the same thing wherever you go. So I have authorized the chain of command the authority to establish restriction of movement procedures upon return from traveling. So again, consistent with what Governor Inslee is talking about, and the chain of command has the ability to do that, and it's in there as the 06 commander. So your chain of command will be able to tell you what that'll look like, and I'm certainly willing to answer any questions. So that everyone knows, we will not make any changes to our child development centers, our medical facilities, or Waller Hall and processing. These are all essential services for readiness, any of the in-processing, those kinds of things that will continue to happen. We're going to keep the same. We have empowered our commanders to make decisions about shift work and telework. And again, there's a lot of things that can't be done with telework, and but we have commanders can make those decisions that's out there. I know that's tough to do this over the holiday. Tough thing to do, but we do have to do this. And I want to encourage everyone, especially as we look to Thanksgiving, to focus on what we're grateful for. One thing that I know that we're all grateful for is that we all still have our jobs, and I think that's big. There's a lot of our fellow Americans out there that are out of work or struggling to keep their small businesses afloat. I'm also grateful to be home, and I know many of you out there have spent many holidays deployed to Iraq, Afghanistan, or wherever else, and I know getting to spend, even with my wife, and I know it can't be with my kids, except for over MS Teams or FaceTime, I'm thankful for having that as well. Okay, I know that there's probably some questions out there. We have experts if we need them. We're ready for your questions. Okay, first question is from Ann. Any changes to medical clinics, processes, or procedures? I'll still have Dr. Roof coming up, but the short answer to that one is no, from Ann.
Good afternoon, and thank you, Ann, for the question. You know, we continue to provide robust access to care for outpatients, inpatients, for readiness demand, and for surgeries as well. You know, we continue to monitor the environment closely, but at the present time, we haven't had any impacts, and we're still able to provide that robust access. I will tell you that if you are looking for an appointment, we can get you a virtual or an in-person appointment. Recommend you contact us through the MHS patient portal, or you can call the Puget Sound Appointment Center at 800-404-4506. Thank you.
Thanks, Dr. Roof. Next question is from Ginger. Can the doctors explain any trends they are finding through contact tracing? Dr. Mace, can you take that one? It's from Ginger.
Hey, Ginger. So the trends we're seeing with contact tracing are similar to what's being seen in our community, just as General George mentioned. We really are part of the greater community. We're seeing transmission among small social groups. So it definitely is social events. It's not necessarily big events. It's things like dining together previous to today in restaurants or in homes. Things where people are perhaps not distancing, not using masks, not using the NPIs we know that will help prevent disease. That's where we're seeing, where we can attribute a cause, that's the biggest group we're seeing. The workplace remains relatively safe. There have been some contacts linked to that, but again, it's relatively safe, and most of what we're seeing is in social settings. And then there are also some cases that we're seeing where there's no clear link, and that just, to me, highlights the importance of doing the things we know we need to do, avoiding large crowds, using our masks, keeping our distance at all times, and whenever we're out and about.
Thanks, Dr. Mace. Next question from Johnny. Will DA civilians be affected by this again? Colonel Duncan, you want to take that one from Johnny?
Yeah, thanks, sir. Thanks, Johnny, for the question. DA civilians will be affected slightly differently from our uniformed members, and I'll give you a couple differences, but everything else is going to be the same. So we are maintaining essential services, as the CG just mentioned. So civilians will still be there to serve all of our customers across the garrison, and I think this is mostly true for Madigan Army Medical Center. I'll let Scotty, Colonel Orff, back me up on that. But across the garrison, civilians will still be here to provide services as necessary. We might telework a few people. We'll go through that list, and your supervisors will let you know. The couple areas that it is slightly different for civilians than military is if you need to ROM, if you need to restrict movement based on leave, it will require you to take personal leave to do that ROM time. That guidance came down through civilian personnel channels. So more to follow from your supervisors as we learn all of this. This one is a quick turn, but we'll make sure we keep in touch with you through your supervisory channels. Thanks.
Is there anything you want to touch on that, Dr. Roof? You want to?
Yes, sir. I'll just mention that we are likewise looking at telework opportunities for our folks, but only those that will not impact patient care. We want to maintain that access and readiness. So we will look at it, but just for specific areas.
Okay, thank you. Okay, next question's from Sam. Will there be another supply issue with the commissary and PX? We've had a long discussion. Colonel Duncan's ready to talk about that one.
Yeah, thanks, Sam, for the question. Right now, we have checked. The supply chains have told us that they have the supplies to be able to continue as per normal. We are, to be clear though, we are going to kind of wait, be cautiously optimistic on that. And we have already, unfortunately, seen a little bit of hoarding at the commissary. So we are going to put some limits in the commissary on some key items. You remember the time a few months ago when paper towels and toilet paper were taken off the shelves. We have seen a little bit of that already, so we are going to restrict the amount that you can purchase at the commissary. Let me just give you a really quick rundown of things that you will see limits at the commissary. Bleach, disinfectant, sanitizers, a couple of types of soaps, some baby wipes, toilet paper, paper towels, and gallon water jugs, and then several types of meats, turkey, chicken, and beef. You can still get, there's still enough here you can get for a family. So, but we're asking you to take basically 2 of each kind of meat, and then there will be signage for specific quantities of, soaps and paper towels and things like that. But again, the supply chains right now look solid, so we should be able to keep this going. We are going to limit the capacity, as the CG mentioned, in the commissary and the exchanges to 50%, so people will still be able to get in and get their life necessities. And then for the exchanges, we don't see any issues with the supply chains or need to meter those products at all right now, but we'll let you know if there's any changes to that. Thanks.
Okay, hey, and what I would ask our team to do is that if we can just post that. I think there's a list. I have it right here in front of me. One of my favorites is on there, ramen noodles. I just would ask that we go ahead and put that on just so that people understand that, and we'll post that for everybody. Okay. Thanks, Guy. Next question was from Tony. Can I still use my unit's Beaver Fit fitness box? Answer is yes, it's outside. That's encouraged. Anybody, any doctors over there disagree with that one?
Sir, I don't want to disagree. Is that Tony?
Yeah.
Hey, Tony. Great. I don't want to disagree at all. I just want to jump in and say, absolutely, like the things that we're concerned about, the things we're talking about, being ready, our mental well-being, even our safety. It's so important for us to stay physically active and physically fit. It helps us prevent infection, both COVID and other types of infection. We feel better. It is good for our mental health. And so absolutely, all of us need to find ways to stay fit. Beaver Fit gyms are great. Outdoor running, even in the rain, it's good. So absolutely need to stay active, need to stay fit.
I love it. Yep, exactly. Next question's from Whitney. How will this affect field exercises? I think I said up front in the comment, there's things that we have to continue to do. Training is actually proved to continue to be one of the safest activities that we have, and we have with our PM docs are involved in that. We have surgeons, medics, and doing all of those things. So we will continue to do those things and put in the proper COVID mitigation measures as we're doing it. Jeremy? Okay, next question is from Jay, and this question was, will Winterfest be canceled? We just talked, I think we just made a decision on that. Sky, you want to give them the decision on that one?
Yes, sir. Thank you, Jay. So Winterfest, we're not going to cancel Winterfest. We are going to slim down we're going to take out one portion of it. So the ice skating, we'll push to later in the winter. The tree lighting is still going to go on. It's virtual. And the Trees for Troops will still go on, and that's a scheduled, you call ahead, you schedule a time, you come pick up your tree. So both are absolutely COVID safe and just basically individual people groups. Please tune into the virtual tree lighting though. We'll light that beautiful tree, the prototypical Christmas tree there in front of Jensen Fitness Center, and you'll all be able to tune in for that. Thanks.
Thanks, Guy. Question from Michael is, can soldiers gather in common areas? And I think, and again, I'll have the docs come up, but yes, as long as you've got physical distancing and masks, and it's just the general rules that we need to continue to abide by. Next question is from Dylan. Are we supposed to restrict, our movement every time we re-enter the state? Yes, that's right now. That's according to Governor Inslee. That is a requirement. It's why when you're going to go do whatever this is that you're talking to your chain of command, that will be a chain of command decision with you. We can certainly take a look at all of those as they come up. Next question is from Christopher about babysitters watching our children in our homes. And this is an important question here because we had said there's no change to childcare. So it's exactly what we've been doing all along and been consistent with in-home childcare. Any comments on that? I think that's consistent with what we've been talking about. So that's a no change, but go ahead.
All child care will be as it is now. We're going to have family child care, school age care, and in the child development centers.
Okay, thank you. Okay, so it says, this one's from Isabel. What happens to the positive people that are at JRTC right now? So what I do know from JRTC, and we've been in constant communication with them, anybody that's down there, it's actually a very restricted environment. They moved into quarantine. They have very strict testing protocols that will down there, and they've actually have separated folks. So I'm very confident with what they've had down there to make sure that they'll separate those folks and then everybody else that can continue training, and no one would be entered back in their unit without being cleared by the right medical professionals, nor would they return without being cleared. And again, these are things that we have to do to continue to maintain our readiness. I'll see if any of the docs have anything to add to that, but I think I covered that one. Okay, this one's from Chivoni. Where can soldiers go to get tested for COVID? Somebody want to cover that? Dr. Leonard? You want this? There you go.
Oh, so thank you, Jblm, for the question. So there's several places that soldiers can go get tested. One of them is being tested in the community, which you can do, but there's a payment associated with that. The most common place where soldiers are getting tested the symptomatic folks are getting tested at our testing tent back behind Madigan. We've been operating that one for the duration of this pandemic. You also could get tested there if you're identified as a close contact by one of our tracing teams for somebody who was symptomatic. And then you can also get tested there for any kind of directed testing, whether you're going on TDY and require a test, you get tested there. What we don't test at the tent are folks who need testing for personal travel or other asymptomatic conditions other than what we had already mentioned. So, thank you, sir.
Thanks, Dr. Leonard. Okay, important question here about doing Black Friday from Florian. Will the PXBX still do Black Friday? Sky, you want to talk about that one? We did also talk about that one.
Okay.
Florian.
Thanks, Florian. Yes, they are still going to do Black Friday. Stay tuned to their advertisements though, because we're going to look at maybe spreading that out and maybe making it a little bit more of it cyber. Because what we don't, it's going to be 50% capacity at that time still. So I'm trying to choose my words here, but it's not going to be a super effective Black Friday if you can only have 50% of the store, and that is what we are going to stick with, is that percent. So what we're going to look at is kind of spreading that out a little bit further. We don't have that exact plan yet, though, so just please stay tuned to the advertisements. Good time for me to download the Digital Garrison app, because that is co-sponsored by AFES, has all the installations on it, and it'll have all their updates and all their advertisements on it, as well as all the information about JBLM specifically.
Okay, thanks. And again, so these changes happened over the weekend. We have been working to kind of figure out what's the best way forward with all of this. So these kind of questions, you got questions out there about that. We did get this one earlier, and so they're already working to try to figure that out. Next question's from Matthew. Will we reduce manning? Again, I would ask the commanders to take a look at that. Every is specific to the unit. We have to continue with operations and readiness, essential services, all of those things. So if there are places where it makes sense to telework or to make adjustments, I know commanders will do that. Next question is from Eric. What if we have scheduled surgeries? Are they still scheduled, or will it change? Dr. Roof, you want to?
Eric.
Yeah, Eric.
Eric, thank you for the question. Yes, if you have a scheduled surgery, you will have that surgery. So we are continuing to monitor that, of course, but we have no plans to change any surgery based on the current conditions.
Okay, I'm going to call you right back up here. This one's from Matthew. Will this affect medical evaluation boards? I think the answer to that is no, because it hasn't affected it this whole time we've been doing it, but I'll let Dr. Roof talk to that as well.
That's correct, sir. Thank you for the question. It's an important one. MEBs are still going forward. There was, at the beginning of the pandemic, a slight pause, but we are continuing to move those forward. So, yes, sir.
Okay, thanks. Okay, I guess there's been a lot of questions out there. Do we have a COVID outbreak at JRTC? I'm not tracking that we had a COVID outbreak at JRTC. I am tracking that the numbers are consistent with what we've seen in other training centers, so I am not tracking that. But definitely for anybody who's in that's out there in 1, 2, or 5th SFAB, we will make sure that the chain of command follows you up specifically with what's happening down there. I will tell you that if through contact tracing, so if anybody's positive and then whatever do the contact tracing, they will be very aggressive about quarantining and separating folks that are down there. Next question is from Beth. What impact will the restrictions have on PT? Okay, we're going to be specific about PT as far as obviously, and Dr. Meese explained this earlier, we want to do outside as much as possible, people being outside. I've asked again, we've gone back to fire team or crew PT, so we're talking no more than 5. Okay, next question is from James. When will the flu shots be available? I think we have a bunch. I'll get Dr. Meese to come up here. I will tell you, I went, when this first came out, I went out to Safeway with my wife, and it was very easy, and it was handled by TRICARE and was able to get my flu shot in no time. Dr. Meese, you want to mention anything else about flu shots?
So is that from James?
From James.
Hey, James. Yeah, so flu shots are available and have been available in the community Lots of folks have availed themselves of that already. We've received several large shipments that have gone out to the units, and so the units are starting to push that out as well, and lots of soldiers have got that as well. So we're starting to see our percentages rise in our active duty population. The clinics have started to receive that as well, and so some folks are receiving that through routine visits. James, we also have a flu drive-through that will be happening on McCord, directly across from the McCord USO, near the PAX terminal at McCord. That'll be happening the 1st to the 5th of December. That's a Tuesday through a Saturday. And all Madigan beneficiaries ages 8 and up are invited to come get their flu shots there. We will also have at some of our CYSs on the 7th, 9th, and 10th. On the 7th, it will be at the Lewis North CYS, the 9th is the McCord CYS, and the 10th is the Cascade CYS. We'll be offering vaccine to the kids who attend there and all other family members who may want to get the shot who come in at that time. So we'll be offering flu shots as well. So lots of options in the community, either off post or as well those that we mentioned on post, as well as through your routine health care and your units.
Thanks, Dr. Meese.
Yeah, I got a question from Jason. He asked about BLC, and he said, what does BLC look like under these conditions? And the reality is there is really no change. We're still doing the virtual Blackboard BLC under our PME guidance, and we actually have the flexibility through TRADOC and through the Academy to flex our needs, and so we're going to stay virtual. We were looking at in December transitioning to a hybrid, virtual and in class, but depending on what happens around the 14th of December, we can make that decision. But right now, we'll stay virtual Blackboard, continue getting on, logging on, and conducting your coursework with no changeover.
Thanks, Sergeant Major. Next question's from Luke. Is Santa's Castle still going forward? From Luke. Sky.
Thank you, Luke. Yes, it is. And they prepared this year for COVID, so everything is online sign up. You park your car, and they bring the selection out to you. So yes, it is still going on. Please continue to coordinate with your chain of command for that. And while I'm up here, I'll speak about turkey drop and ham grenade. Those are also both going on, and again, work through your chain of command for that. Those are the chaplains that are doing that. So thank you both to Santa's Castle and to the chaplains for all the assistance on that.
Yeah. Okay, next question from Chuck. Is the Madigan drive-through pharmacy still open? Answer to that is yes. Anything you want to expand on the pharmacy operations? Dr. Roof, from Chuck.
Yes, Chuck, thank you for the question. The Madigan drive-through pharmacy is still open. You'll notice that there's been quite a number of changes over the entire course of this pandemic, whereas the wait times have decreased dramatically in the last few weeks. We do have the pharmacy lobby open for very specific patients, for emergency room, for post-operative patients, and for those that are seen in the clinics at the same day, so they can go into the pharmacy lobby. However, everyone else goes to the drive-through. Thank you.
Okay. Next question's from Raven. In what way will the Northwest Adventure Center be impacted?
Thanks, Raymond. The NAC will be affected in that it will go down to 25% capacity. It is a retail store, but you can still get your rentals there for your winter activities. The only thing we're not going to rent is things for parties, because we're not really doing parties this time of COVID. So, but please come there and get your skis, get all that kind of stuff, and your retail purchases can still be done. Thanks.
Okay, thanks, Guy. Next question is from Maddie. Will those returning from JRTC need to ROM? So again, we're still looking at assessing this. Again, what I will remind everybody is that they are, from having been at JRTC several times and knowing what they're doing right now, they are basically isolated completely as a unit out in the training area, and even when they come back and start doing their vehicles. So we are still considering exactly what that'll look like, but they are in a bubble right now while they're training, and the same bubble when they come back as a unit from that exercise. Okay, next question is from Jay. Is COVID testing available for civilian employees as well? Dr. Meese, you want to handle that one from Jay?
Jay, COVID testing is authorized for civilian employees who may have an occupational contact to COVID. So if here on base you're working and you're potentially exposed and referred by one of our contact trace teams or one of our contact tracers, then yes, it is authorized. Similarly, DA civilians who are PCSing or TDY and have official PCS or TDY orders are authorized testing. DA civilians who are symptomatic and do not have a close contact are not authorized for testing here and would need to get that off post.
Okay, I don't want you to go anywhere because I just had a question here from Andressa. What are we doing to keep our pregnant soldiers safe? You can answer that. I got my own thoughts, but.
Sure. Yeah, happy, and that's Vanessa?
Andressa.
Andressa. Hey, Andressa. So I think the things we're doing to keep our pregnant soldiers safe are similar to the things we're doing for all of our soldiers, which is we need to make sure we're wearing our masks. We need to make sure that, and I'll highlight, you know, the CDC recently released a science update highlighting that masks are protective to us as well as to others. So we wear our masks to show our respect for others. We wear our masks to respect our pregnant teammates, but also all of us can wear this to protect ourselves. We need to be keeping our distance. We need to be keeping our formation small and using virtual platforms where available for meetings. Those are all things that we're doing to keep our pregnant soldiers safe. I'll just add, I'll put another plug for PT. We do have our pregnancy profile PT. My shop has a hand in that as well. And so healthy living during pregnancy is really important. Healthy diet, healthy activity, and a good amount of sleep. All of those things are important as well for keeping our pregnant soldiers safe.
And I would add, if anybody has any specific concerns, that they should go see they should talk to their chain of command and they should talk to their doc, most definitely. Okay, next question is from Jason. Will PCS or permanent change at stations get delayed? There's been no change right now in any of the movement that I'm tracking at all, or no plans for it. I'm looking over at the G1. Next question is from Nate. Will the pools still be available for unit training? Yes, we are that's the exception that we're making on pools, and we have COVID mitigation measures that are in place for that. Again, active duty, activated guard, and reserve. Okay, next question is from Joanne. Does Madigan have an issue with bed space or respirators? Dr. Roof?
Joanne, thank you for the question. No, we do not have any issues with bed space or respirators. We continue to monitor that closely, of course, and we manage that effectively so that we can still maintain access to care for our critical inpatient mission. I would note that we haven't had the number of inpatients with COVID that they've seen in the community, although we still maintain a robust inpatient population, and we do have a robust ICU service as well. Thank you.
Okay, thanks, Dr. Roof. Okay, next question is from Marcos. Will the COVID-19 vaccine be mandatory for soldiers? So I'll ask Dr. Meese to come forward, but I mean, I will say we don't know right now. We're still waiting on any information with the vaccine. Dr. Meese can kind of talk you through this, but as long as I've been in the military, a shot has never been voluntary. As long as I've been. I don't know about you, Sergeant Major, but never been voluntary.
Yeah, Marcos, so I'll just say, we don't know. We're tracking this closely. What we can tell you about the COVID vaccine, and when we say COVID vaccine, there's really several that are being developed right now. What we can say is that the data coming out of the trials that are being done is promising. It's encouraging. I would also say that early in the summer, there was some some feedback and some noise about people concerned that maybe this is being pushed through too quickly. And I would say that the data suggests that it's happening appropriately. All the timelines are being met. Prominent national experts are backing this and saying, yeah, the FDA is taking the right steps, things are moving the right way. So I think we can be confident once the vaccine is available, it will be safe and it will be effective. And we're just standing by and watching as this process develops for exactly when we'll be able to get it and offer it to folks.
Okay, and then just one other, so what we also don't know, though, probably be as far as who's going to get the vaccine and when, I've just read what's online. It's probably going to go to those who are more fragile, frontline healthcare workers, so it might be a while. We would be down the pecking order as well.
Yeah, that's correct, sir. So we're standing by, but we do know, or we do expect that when the vaccine is available, it won't be all dropped on us in one fell swoop, but it'll be small amounts and then larger amounts further down the road. We expect that it will be available in a tiered manner, and what those tiers will look like is still to be determined. But yeah, probably emergency services personnel, frontline healthcare workers will be at the front. We'll prioritize those for health purposes as well. So more to follow, but those are some of the things we do know and do expect.
Thanks, Dr. Meese. Okay, next question is from Mandy. Can we still rent cabins? I think the answer, yeah. Short answer to that is yes, you can. Next question from Joanne. Will airmen be restricted from seeing out-of-town family? Do you want to take that one, Aaron?
Thank you, sir. So I'll expect that airmen will follow the same rules that General George just outlined in the beginning of his speech today. So the expectation would be no indoor gatherings unless you follow Governor Inslee's rules for those. Additionally, I'll just highlight we're not restricting leave, just like the Army's not restricting leave right now. You're welcome to go home, and I'll expect that you'll ROM on the back end when you come back to ensure we don't bring COVID back into the area. That's it, sir.
Thanks, Aaron. So very similar question we just got from Drew. Can we still take normal leave outside the state of Washington? Again, much like Colonel Stainpine just talked about, chain of command approval, we're not restricting that. And then you will have to talk to your chain of command, and then we'll look at restriction of movement on return. A question from Corey about, will I still be able to travel for Christmas leave? Again, right now, the whole point of doing this, and for anybody who listened to Governor Inslee yesterday, is a real focus here for the next 30 days to take that curve down where we have with COVID cases, so that we're in a much better position for the Christmas holidays, and that's where we expect to be. Okay. Here's the next question's from Sarah. What is the guidance for families visiting out of state to those who live on the base? Okay, so we had this discussion earlier, and again, this is the same thing. Somebody said, hey, I got family coming in, and I'm getting ready. This is the only opportunity to see them, or they've already paid to come out here and see our family and our kids. So it's mom and dad, whatever. So again, what Governor Inslee has put out is that he would expect some kind of restriction of movement on that end before they come in the state. And I think what he's requiring is a test. And what I would ask is that you just inform your chain of command that you got family coming in, so that we're aware of that, but certainly not restricting any visitors from coming on the base. Next question is Stone Education Center staying open? I don't think any change to Stone Education Center whatsoever. Okay, this is a good question from Charlie. Will there be an impact to housing work orders?
Thanks, Charlie.
Got that.
No. Short answer, no. This is, we've received several questions, and I appreciate the questions about services that may have shut down. And this is something we did earlier in order to save manpower and keep people safe. But we've learned so much through this time of COVID that we can tweak and fine tune a few things. And this is one thing that we know we can now continue. So they're going to continue asking the questions if there's anybody that's been exposed to COVID in the home, and they're going to continue taking all the precautions, but we are going to continue the routine work orders and making sure we give quality housing to folks. Thanks.
Thanks, Guy. Next question is from Teresita. Can I get a COVID test from Madigan before I travel? I know on official travel, yes. Dr. Macy, you want to answer the full answer to that one?
Teresita, if it's official travel, if you have PCS or TDY orders, then you can get that test. If not, you'll need to find a test on the community. The Tacoma Pierce County Health Department webpage has a list of a whole bunch of sites in the community where you can get that test if it's not for official travel.
Okay, can you stay right there, Luke?
Sure.
Next one's from Joshua. Will the vaccine be available for dependents? I think you've already answered that one. And yes, it will be available for everybody, but
yeah,
pecking order.
Joshua, the vaccine will be available for dependents. Exactly when it will be available is still to be determined, and we're standing by. And exactly what priority that'll be, again, we're standing by and following that as the vaccine is developed and the release plan is developed.
Thanks, Dr. Mace. Okay. Question from Greg, will the barber shop remain open? Yes, it's going to be at 25% capacity. I think we've already kind of figured that out. We are going to ask to do the sign-in for the contact tracing. Next question from Ryan, what are the impacts on dental clinics? No change to the dental clinics. One thing we haven't been doing because we don't feel that was safe is dental cleanings, but everything else is continuing the same at the dental clinics. It's a readiness issue. Or readiness requirement for us, no changed. Next question from Ann, where should I go to get the most up-to-date information on what services are currently being provided? Again, we are the blue hash, and I don't see that changing over the next 4 weeks of what we're doing because of staying in line with the state of Washington. But if there are any updates, it would happen on the JBLM website, Facebook or Twitter, but go to that JBLM website. As Colonel Duncan mentioned, the other thing is the Digital Garrison Act that we're working. We just figured out, I think, announcements that we're doing on that. Real good work by our team to do that. So if you download that, and we're also looking to put announcements out if there's any last minute changes, that would be a way to do it. Next question is from Shasta. Would long-term COVID complications count towards my disability rating? I can't answer that one. I need a phone a doc here on that one.
Shasta, as far as long-term COVID complications go and a disability rating, I would say it's too early to say exactly what the VA has officially stated about disability and COVID is that people's payment and people's processes, they're doing everything they can to not have those delayed, and that's for all conditions. As far as what some are calling long-term or long-term consequences of COVID, I think it's just too early to say. What we do know is that the VA takes into account the condition and the impact on the individual as they make their disability rating. And I assume as the science on COVID evolves, which it's evolving rapidly, that the VA will take that into account, given what I know of their processes and how they operate.
Thanks, Dr. Meese. Still coming. Next question's from Caitlin. Is childcare open? The short answer to that is yes. Why can't kids go to school? Do you want to answer that one? I know we make that with Clover Park.
Yeah, thanks, Caitlin. Thanks, Caitlin. I understand that this is an emotional issue and a family issue, et cetera. So childcare is still open for on base, as we've discussed. Schools are not open. So obviously the reason for your question, I understand it, but the school districts are making choices based on Washington State guidance and based on the infection rate. They were close to being ready to open schools. Clover Park specifically, which is the one that has the schools on base and is one of our close partners off base. We maintain close communications with all of the school districts, the 13 school districts around us through our school liaison officers. You've seen them on these town halls previously. So we will continue to give you updates, and we have what we call the one-pager on the JBLMMWR website that lists all the schools and what their current status is. Right now, they are still currently all virtual. And they're doing this based on the science that they have of the infection rates and the spread to keep all of us safe so that the kids don't get it and then take it home to the families and spread it even further. And another reason is they aren't able to do quite the precautionary measures that we are in the CDCs and the school-age centers. They just aren't able to do it in that large of a scale. We can do it because we know we have 10 kids per room and so many care providers, and we can enforce PPE at all times and things like that. Schools are just a little bit too large to be able to do that. We hope to be able to open them up in the schools. I know we're hoping to open up in January, but you gotta stay tuned to our website and really even more to their websites. Well, they'll keep everybody updated.
Yeah, so I just want to reinforce what Colonel Duncan mentioned. We have great resources here with our school liaisons, and that we have the information on the website. We're not making that, we will help keep you aware of the decision that are public schools that are on our installation, and so we just work with them to keep you updated. And obviously, wherever you're at with the school, probably even besides our website is their particular websites for whatever school that you have. Kat asked the question, any change to CDCs? And again, the answer, I think we just were talking about that, no, but come on forward. You can answer that one anyway.
Yes, the CDCs are open, family child care is open, and the school-age services is open. I do want to announce that we're going to do a pause with our youth sports program because they're all indoors right now. And the state of Washington just came out with indoor activities have to have a pause. And we don't have any outdoor activities right now. So we will put a pause in place for those activities. You will be given a credit in your account, and we will keep you fully posted as to what we're going to be doing if you've got a child already in one of our sports programs.
Okay, great. Thanks for highlighting that. Okay, question from Melinda. Are there any changes to labor and delivery? I think the answer is no, but Dr. Roof, you want to come up and talk about that?
That's correct, sir, and thank you for the question. No, there have been no changes currently to our labor and delivery plan. We still allow 2 adult visitors while the mother is in labor throughout that whole time period. Once the baby is delivered, we do ask that even though you're allowed 2 adult visitors, only 1 spend the night. So after delivery, that's 1 adult visitor can stay with you throughout your hospital stay. Throughout the day. The second one, we ask that you adhere to our regular visitor hours, which are 8 a.m. to 7 p.m. And we would like that to be just those 2 visitors. In other words, not rotate that one in and out during any given day, but you can change from day to day.
Okay, thanks, Scotty. Question from Mike, are ranges still going to happen? The answer to that is yes. We still have to maintain readiness, so those essential things that we would do, we will continue to do those. Next question from Christy, are you requiring contractors for restriction of movement on returning to the state? You want to cover that one, Sky?
Thanks, Christy. Yes, bottom line, yes, contractors need to follow Washington State guidance. I'll refer you though again to your chain of command, which your contract chain of command, which your supervisors and your contracting officer's representative for each specific contract. Because if it's an essential contract, then they might take down that lessen that ROM time, but please go work through your individual contract leadership for those specific details. Thanks.
Okay, thanks. Question again, we had this one earlier, but I'll repeat it from Kristen. Do I lose leave while forced to ROM? And the answer for service members is, the answer to that is no. Again, you expect to go through your chain of command on the leave. And Colonel Duncan actually put out that there's been some updated guidance from OPM that actually civilians would need to take leave for their restriction of movement. Question from Sherry, under the GO, am I allowed to visit my boyfriend? Again, we are going to be specific in this as far as, somebody's out here, as that is a, part of their, of the family unit, a boyfriend or a girlfriend, and so yes, we are going to allow that, mainly because I know it's going to happen anyway. Okay, last question. Does the spouse have to quarantine ahead of a baby delivering to attend the birth? It's a good question.
That's a good question, and thank you. No, that is not a requirement. Spouse does not have to quarantine before the birth. We do ask that you continue to adhere to those NPIs, those non-pharmaceutical interventions, washing your hands, wearing your mask, and the like. I would take this as an opportunity to say, in contrast to what I told you about visiting for labor and delivery, if by chance that the mother is COVID positive, then we change that visitor's policy. We ask that there just be one visitor throughout the entire time that stays with that individual, the delivering mother, throughout the entire time. But to answer the question, no, there is no requirement for quarantine by the spouse beforehand. Thank you.
Okay, thanks, Dr. Roof. Okay, I want to thank everybody for tuning in today, and especially on short notice. Again, our intent was we got this information over the weekend, got everybody together here, just to make sure that we can get the information out to you about what's going on here at JBLM and our community. And as I mentioned up front, no one likes this, but this is what we have to do right now. I will ask everybody, I'll throw a challenge out there, everybody, to think for the next 30 days that everybody spends 30 minutes outside doing some kind of physical activity or something, that we all remain positive and focus that way. I think it'll be good for all of us out there, and I know that's what I'm going to continue to do. Okay, again, we appreciate everybody joining us, and for those that I won't see virtually or otherwise, wish you all the best and happy virtual Thanksgiving.